Do I really take a measuring tape and go and measure the patients before I inject them? No, we don't do that. Because that's too textbook, and also we lose the individuality of the patient. Because patients have their own individual features that we should think about and we should try to enhance. So we don't look at them as textbook, we look at them as human beings with individuality and certain expressions. So there was an old way of injecting. So basically before, when we were just learning how to inject our patients, we thought about the lines and we go and fill them. So I looked at the clavillar lines and I went and filled them. We looked at the nasolabial fold and we went and filled them. We looked at the marionette lines and we went and filled them. We saw that there's a little bit of loss of the cheeks volume and we went and filled them. This is a very old-fashioned way of thinking. We don't do that anymore. We want a smooth transition between the before and after. So as you can see here, we didn't overcorrect. We thought about victors and we thought about a smooth transition. We don't want to shock the patient. We do want to correct. If you want to do more correction, we actually do the correction over different sessions. So we don't do it from the first time. If you take a look here, this is more a victor, thinking about the victors and lifting the skin with the fillers in order for us to get a more natural look. So if you take a look on the before, you can see that the lateral brow line was down. You can see that the temporal, there's hollowness in that area. There's very orbital hollowness. There's the nasolabial fold. And you can see also hollowness below the cheeks. And there are subtle differences between the two sides, but it makes a big difference in brightening up the patient and making them look younger. So just by injecting over the temporal area, we were able to, there's ability to uplift the eyebrows. Also filling the space over the eyebrows also gives it a lifting effect, a more natural, youthful effect. When we try to correct the nasolabial fold, we're actually looking into placing a bolus of fillers on the zygomatic arch and over the cheeks. And this causes a lifting effect of the nasolabial fold and more natural look to the nasolabial folds. Also, when we're correcting the marionette line, we're looking into the angle of the mandible and injecting there to form some sort of victor effect and some sort of lifting effect. So this is a cool way of injection. Now we think about victors. Keep in mind that in our back of our heads, and also we want natural looks. We don't want overcorrected looks. Overcorrected looks, it's not a good way of practice. So the techniques, I like giving the patients, I like involving my patients, so actually I give them a mirror and I ask them, what is bothering you when you look in the morning? What does make you feel that you're getting older? So she points out what is bothering her. Do not point to your patients what's not bothering them. Because if she doesn't see it, why are you pointing it to her and making her unhappy? We are there to make our patients happy, not ourselves happy. So I like to only correct the areas that she feels that it's bothering her. So be involved in that. Now, it's a different story if the patient wants a total facelift. This time, when they ask for something like that and they totally feel like they need something like that because they don't want to go to the surgeon and do a facelift, then you look at the patient in a different way. We look at them in a multi-dimensional approach. So I don't only look from the front, we look at an oblique way, we look from the sides of the patient's face, and we look at the defects, and we look on how we're going to correct them. So after I look into a multi-dimensional approach, we look into the volume loss. So we have to keep in mind that the volume loss is due to multi-factors. It's not just about the fat loss, but there's also muscle atrophy with aging, and there's also bone loss. And this is also what causes the deep lines due to the volume loss. Okay, so we're going to understand what I'm going to say because they understand makeup and contouring. So what are we trying to do when we do contouring makeup? We're actually trying to enhance areas where the light is coming and decrease areas where we don't want the light is coming. And this kind of approach also we try to apply it to our injections. I want to emphasize areas where the light is falling and make it a more youthful, more smooth transition. So, like I said, we look at the impact of light and shadow on the facial appearance. We actually look at the hills and valleys. So with time, when we lose volume, we actually have hills and valleys on our face. And we want to do a smooth transition between the hills and the valleys. So we don't want these dips in the skin. And we also try to improve the profile of the patient. So we look at them from the sideways and we see what we want to enhance in them in order for them to get a better profile or a better selfie. I would like to divide the face into divisions, and then we take it from there when we're trying to inject. So we start with the upper face, and we look into the forehead, the temples, and the lateral brows. Then we take the mid face. And this approach actually also helps us with lifting up of the face. So by working upward, going downward, we actually will need less fillers as we go down to the base of the face. So because it also causes a lifting effect. When we look at the mid-face, we think about the teardrop, the cheeks. The cheeks actually is consistent of the zygoma, filling up the zygoma, or on top of the zygoma, and the cheeks, and we also look at the nose. The lower face, we look at the periocular area, the lips, the jawline, the mandible, and the chin. We should not forget the neck and the décolleté. Working only on the face is really bad. We don't do that anymore. Because you don't want a face that looks like 40 years old and the neck of a 60-year-old. That looks really bad. That's not aesthetically beautiful. And we try to achieve a full face rejuvenation. As inject, like I said, we work with the Victors and we want to lift the face. I like injecting boluses over the periosteal areas in a gunshot technique. We also, as I said, we lift the temporal area. When we inject the temporal area, the brow is lifted. We inject over the cheekbones and the zygoma and the nasolabial fold. You will see that we will need less fillers afterwards. We help with the jawline by defining it, and this helps with the magnet lines. We restore then the volume loss. We look after that, we look into the deep lines, and you will notice that the more you put fillers in a Victor fashion, the less fillers that you're going to need to put into the lines. And we try to we enhance the facial balance by enhancing the profile of the patient. So we work on the nose, then the lips, the cheekbones, the jawlines, and the chin. And we should not forget the fine lines, like the accordion lines on the side of the face, because everything is lifted, but then when she smiles, she gets like a lot of accordion lines, and that's not very useful. And as I said, we should not forget the neck. So this is where we inject, and now we are lucky because we have fillers that don't cause dental effect. Before, when we inject superficially, we get a blue bump, and this is not aesthetically nice. So now with the new fillers, we actually can inject the superficial dermis and no dental effect. We inject into the mid or the deep dermis. I love injecting the periosteal area because the hyaluronic acid fillers kind of just molds with the movement of the face, and it gives a natural look with time. To get a very smooth, smoothing of the fillers when you're applying them, you should actually alternate between the needles and the cannula. Some people only like to use the needles, and some people only like to use cannulas. I like to use both because I like using the needle in areas where I want to do bullous techniques, and I like to use the cannulas in areas where I want to do a fanning and a more smoother look for the distribution of the filler. So this really depends on your, it really depends on the aesthetic practitioners' early training and what they're comfortable with. But both techniques are fine. There has been talks about using the cannula is more safer because of the blunt edge, but there has been studies in which the cannulas have perforated arteries and caused occlusion. So you still have to be careful. We have to also think about our patients and what beautiful means, and it's defined differently globally. So not all patients are the same. Put into consideration the ethnic background of the patient. We have to think about that. And what is beautiful in their face is different than the Middle Eastern face, than the African face, and then the Asian face. And we have to put that into account. We don't want to make people look the same or look different than an ethnicity, because every ethnicity has its own beauty. So we have to think about that, and we just have to enhance their own features according to their ethnic backgrounds. So what is the bad about fillers? I hate ducks and monkeys. So we don't want the over correction of the lips, where when they move, they look like they're, it actually changes the way they speak. You cannot look at anything else except their lips when they're talking. We don't want duck faces. And overcorrection of lines. We're not supposed to have faces without any kind of lines. That's only for monkeys. You have to have some sort of line still there present in order for us to look natural, to look not overcorrected. So, what is the ugly side of the fillers? This is the ugly side. You can have necrosis, you can have granulomas, and you can have bumps that never go away. Side effects of fillers, pain. There's simple ones, which is immediate post-procedure, and they usually resolve, such as pain, needle marks, bruising, and swelling, and that's totally fine. Asymmetry can happen, either with overcorrection or undercorrection. Most of the time, if I just leave the patient for 1 week or 2 weeks, it corrects itself. Because the hyaluronic acid also molds according to the, with the new generation of fillers, it actually molds to the person's movements. And it actually also absorbs water, so it gets hydrated. If it's persistent, then we can always correct it with a hyaluronidase injection. So infection can also happen. We also hate the Tyndall effect, but this happens. But if you choose to inject, if the aesthetic practitioner chooses to inject superficially with the new types of fillers, with the low G prime, we can actually we won't have the Tyndall effect anymore. So this is kind of like not there anymore unless you choose a bad filler. Nodules and granulomas, these are also another nightmare because some inflammatory granulomas can happen and they can be weeks after the injection. We have to make sure that it's not an infection, and sometimes we can treat it with steroid injections, but if it's not treated by steroids, we can always surgically remove them. The really ugly phase of fillers are the anaphylaxis, the skin necrosis, blindness can happen, and some situations there were death. Unfortunately, these complications are very, very rare, unless you're really bad. So our nightmare is always, every time I inject, I always think about this. Every time I inject, I wait for my patients to come back and see that there's no vascular occlusion, because the areas that we inject all are danger zones. So in the glabella, as I said, there's a risk of necrosis. We have the nasolabial folds because of the angular artery occlusion, the lips because of the labial artery occlusion, the nose, as you can see, it can cause necrosis because of the nasal artery, and we also have to watch out for the forms and the face. Okay, so with this